Welcome back to AM Northwest. If you have receding gums, our next guest has a new, less invasive way to fix your problem. Here to tell us more, we welcome back from Sleep Dentistry Defined, Dr. Heath Lampee. Good to see you again, doctor.
Yeah, thank you.
Tell me about this. This has to do with the gums.
Yes, so I see every day that a lot of my patients have actually worn their gum tissue away up by their root surfaces, and by being over-aggressive with toothbrushing over the years, because a lot of people think to get their teeth clean they've got to use a really firm bristled brush and use a lot of pressure,
right,
when really they don't.
Is that the only thing that causes the gums to do that?
Toothbrushing does a lot of it. Another thing that some guys do is the smokeless tobacco, the dips.
Yeah.
That is also abrasive too and can wear away gum tissue. But the number one reason I see gum recession is over-aggressive toothbrushing.
I see. So what does it cause when you have gum recession? What happens?
So you actually wear away the gum tissue that is covering your roots. Mm-hmm. The roots are a little more porous. They have more nerve endings in them. And so you can have more sensitivity to sweets, to cold, to hot.
Okay. And then how, in the past, what was the old school way to fix gum recession? So
for the last 30, 40 years, we would actually have to remove some of the tissue, the gum tissue on the palate, which isn't very comfortable at all.
It doesn't sound comfortable at all.
It doesn't.
Sounds painful.
But they had to do that for decades. But now what we can do is we actually have donated tissue from tissue banks, and the donated tissue is sterilized, it's totally clean, there's no risk of disease transmission or anything like that. And we can actually suture that donated gum tissue into the area where the gums are recessed. We don't have to do surgery on the palate anymore.
Oh, that's fantastic.
Yes.
And so how long does that process take?
So depending on how many teeth need to be treated, it can take an hour to 2 hours. Sometimes, a person just over-aggressive brushes in one area, but
right,
sometimes they do it everywhere. So if we had to do a whole arch of gum grafts, we could do that in about 2 hours.
Oh my goodness. Let's take a look. You have a before and after picture,
yeah,
and I want you to tell me what we're seeing here.
So this is an illustration, and on the left it shows that the gums have been worn away by a toothbrush, and on the right they have been covered back up with a gum graft, this new donated tissue. Think of it as kind of like a gum lift in a way.
Oh, good point.
Yeah.
So do people, have you done this enough where people say, finally I'm not sensitive to the heat, I'm not sensitive to the cold anymore?
Yes.
Okay.
And now that they have the gum tissue back, we teach them new brushing techniques so they won't wear it away again.
When you have gum recession, does it also, are you more prone to cavities and losing the teeth as well?
Since the roots are more porous, they're also more prone to getting cavities, tooth decay. So yes, absolutely. And if we cover that back up, the risk to get cavities is lessened. Is
there any chance that you could, your mouth could reject the tissue that you're talking about?
There's always the smallest risk. We watch our patients very closely in the first 2 to 3 weeks after the procedure. We also prescribe an antioxidant gel that is applied that helps healing as well. So there's very little risk of rejection.
And you say the process itself, the procedure you're doing, it takes about 2 hours?
Yeah, 1 to 2 hours, depending on how many teeth we're treating.
And can you have something to keep you knocked out while you're doing this?
Yes. Some patients just want Novocaine, but some patients want to be asleep for it. Mm-hmm. I try to be very gentle when I work, so either way, you're going to have a good experience.
Oh, fantastic.
Yeah.
We want to tell folks if they'd like to find out more, you can contact Sleep Dentistry Defined, 503-646-2273. We'll put all that information on our website at katu.com. Thank you, doctor.